My name is Braxton Beach.
My name is Parker Rigby.
Today we will be presenting our OSCE on fascia iliaca nerve blocks using two techniques, one technique using landmark and one technique using ultrasound guidance.
The first one we'll demonstrate is the ultrasound guided technique. This is the equipment you'll need for the ultrasound guided technique. First, you'll need an ultrasound machine with a linear transducer probe, 6 to 14 megahertz. You'll need sterile gloves, anxiolytic medications, two 20cc syringes with 18 gauge needles, long-acting local anesthetic of choice, chloroprep, an oxygen mask for the patient, a 35cc syringe with 1% lidocaine for skin infiltration, a 80 millimeter to 100 millimeter 22 gauge B-bevel block needle for ultrasound technique, as well as sterile drapes, sterile probe covers, and other PPE needed to do the block. Now we'll be demonstrating the ultrasound guided technique for the fascia iliaca block. For time purposes, we're going to assume that we've already completed steps 1 through 9 on the OSCE template. First, when performing the fascia iliaca block using ultrasound, you want to first put on your personal protective equipment that's sterile, and then cleanse your site with chlorhexidine. We're going to then take our high frequency probe on our ultrasound, identify the anterior superior iliac spine, place our transducer in a sagittal direction on the anterior superior iliac spine. In order to get the view we're looking for with the fascia iliaca block, we want to slightly rotate the caudal end of the transducer laterally. This will bring the sartorius, internal oblique, and the iliopsoas muscle into view. After we have these muscles in view on the ultrasound, we then have our correct placement, and we want to infiltrate the skin with local anesthetic. Place a skin wheel of the 1% lidocaine. After we've localized the area, we want to make sure our line is primed through our needle. Then we want to insert our 22 gauge needle at the caudal end of the ultrasound probe, making sure to keep it in plane. As we're inserting our needle, we're going to move it in a cephalad direction, and we're going to guide our needle between the internal oblique muscle and the iliopsoas muscle. Once your needle is between the internal oblique muscle and the iliopsoas muscle, you want to negatively aspirate for blood and inject 1 to 2 cc's to hydrodissect the fascia between both muscles. After this, inject 40 cc's of local anesthetic in increments of 5 cc's following negative aspiration for each one. This is an ultrasound video showing the needle placement for the fascia iliaca block. As you can see, the needle passes in the fascial plane between the iliopsoas muscle and the internal oblique muscle on the top left of the screen. You can see the needle is inside the fascial plane, and there's good spread of local anesthetic between both muscles. You can also see just below the internal oblique muscle the deep circumflex iliac artery and vein pulsating, and that is good confirmation that we are not in the artery or vein and preventing last. After you've inserted your local anesthetic, properly remove your needle, clean your equipment, dispose of your needles, and then monitor for complications of local anesthetic toxicity, as well as bleeding and hematoma.
The equipment you will need for the landmark technique is sterile gloves, anxiolytic medications, two 20cc syringes, two 18 gauge needles, long-acting local anesthetic of choice, chlorhexidine prep, 3 to 5 milliliter syringe for your local anesthetic injection, oxygen mask, 22 gauge needle, and a skin prep pin, and then gloves and PPE. This is our demonstration of the landmark technique for the fascia iliaca nerve block. For time purposes, we have assumed that we have completed steps 1 through 9 on the OSCE rubric. As you can see, our patient is supine with the leg rotated slightly outwards. The first step that you would need to complete is to find the anterior superior iliac spine, and the next landmark is the pubic tubercle. Once you find those landmarks, you want to draw a line between the two. Once you have drawn this line, you need to divide it into thirds. Once you divided it into thirds, you're going to find the lateral third and the middle third, and at the intersection of these two thirds will be your insertion point. Once you find your insertion point, you need to palpate your femoral artery, and your femoral artery palpable pulse should be 1.5 to 2 centimeters medial to your insertion point. And after you've done that, you know that you're in the correct spot. At this step in the procedure, you will now don your sterile PPE and cleanse the injection site with chlorhexidine or betadine. As that's drying, you will take your 22 gauge needle with your local anesthetic attached and prime your line. Now, using your 35cc syringe, you will inject local at the insertion point, making a skin wheel. Now you will take your 22 gauge needle at your insertion point. You will insert the needle perpendicular to the skin and in a cephalad direction. As you advance your needle, you should feel a loss of resistance. Your first loss of resistance, you're passing through the fascia iliaca. Once you've reached here, you will continue to advance your needle until you feel a second loss of resistance. You have now entered the fascia iliaca. Once you've reached that, stop advancing your needle, take your syringe, aspirate for blood and confirm negative intravascular placement, and inject 40 milliliters of local anesthetic in increments of 5 milliliters following negative aspiration. Once you've completed this step, you can take your needle out of the skin and the procedure is complete. Once you remove your needle from the insertion site, you want to clean and dispose of all contaminated equipment and monitor your patient for signs of complications, including bleeding, hematoma, and local anesthetic systemic toxicity.
This concludes our OSCE demonstration of the fascia iliaca block using ultrasound and landmark technique.
We hope that this OSCE was informative and can serve as an educational resource for performing fascia iliaca nerve blocks in practice. Thanks for watching.